In my 18 years as a board-certified gastroenterologist, I've seen thousands of cases of stomach damage, chronic gastritis, and even early-stage gastric ulcers. But there's one that haunts me to this day because it was so completely preventable. And the culprit was something this patient bought at her local drugstore without a second thought, something her own doctor casually recommended, something marketed as gentle and safe, something millions of Americans take every single day thinking they're helping their stomach, when in reality, they're setting themselves up for serious, potentially irreversible damage. I'm Dr. Michael Hayes, board-certified gastroenterologist with over 18 years of experience treating digestive disorders, and today I need to tell you about the over-the-counter medication that could be silently destroying your stomach lining right now, and chances are you have a bottle of it in your medicine cabinet. This is educational content only, not medical advice, and you should consult your healthcare provider before making any changes to your medication regimen. Individual results may vary, and this information is meant to complement, not replace, professional medical care. Let me tell you about Dorothy, a 67-year-old retired teacher from Clearwater, Florida, who walked into my office on a Tuesday morning in September, looking exhausted and holding her abdomen. She'd been experiencing a dull, gnawing pain in her upper stomach for the past 6 months, along with nausea that got progressively worse after meals, occasional vomiting, and a general feeling that something was seriously wrong inside her digestive system. When I asked about her medications, she pulled out a worn bottle of antacid tablets from her purse and said she'd been taking them 4 to 6 times a day for the past 3 years, sometimes more when the burning got really bad. Her previous doctor had recommended them as a safe alternative to prescription medications, told her they were basically just calcium and safe to take as needed. She trusted that advice completely. What Dorothy didn't know, what nobody had explained to her, was that those innocent-looking chalky tablets were slowly eroding the protective barrier of her stomach lining, interfering with her body's ability to absorb crucial nutrients, and creating a vicious cycle where the more she took them, the worse her actual stomach condition became. When I performed an endoscopy, I found multiple areas of gastric erosion, inflammation throughout her stomach lining, and early signs of atrophic gastritis, a condition where the stomach lining becomes so thin and damaged that it can no longer produce adequate digestive enzymes or protect itself from its own acid. She was shocked. She'd been taking these tablets thinking she was being responsible, thinking she was avoiding dangerous prescription drugs, thinking she was doing exactly what her doctor suggested. The truth is, she'd been unknowingly damaging her stomach for years, and she's far from alone. According to recent data, approximately 42% of Americans over age 60 take antacids regularly, many of them daily, and a significant portion have been doing so for years without understanding the long-term consequences. The marketing for these products is brilliant. They show people happily eating spicy foods, living their lives without worry, popping a colorful tablet and getting instant relief. They use words like gentle, safe, fast-acting, doctor recommended. They position themselves as the smart choice, the responsible choice, the choice that lets you avoid harsh prescription medications. But here's what they don't tell you in those commercials. Here's what's happening inside your stomach every single time you take one of these supposedly harmless tablets. Join the thousands of people who have already subscribed and transformed their digestive health by hitting that subscribe button now, because this community is growing and you don't want to be left behind with outdated information. Let me break down the 3 biggest myths about over-the-counter antacids that are causing massive amounts of preventable stomach damage across America. Myth number 1. Antacids are safe to take daily for extended periods. This is perhaps the most dangerous misconception, and it's perpetuated by the fact that these medications are available without a prescription and marketed directly to consumers with messages suggesting unlimited use. Here's the reality. Your stomach produces acid for crucial reasons. It's not a design flaw that needs to be constantly neutralized. Stomach acid, technically hydrochloric acid with a pH between 1.5 and 3.5, serves multiple essential functions. It breaks down proteins into amino acids, activates pepsinogen into pepsin for protein digestion, creates an acidic environment that kills harmful bacteria and pathogens you ingest with food, enables the absorption of vitamin B12, which is absolutely critical for nerve function and red blood cell production, facilitates the absorption of minerals like calcium, magnesium, iron, and zinc, and helps regulate the movement of food from your stomach into your small intestine. When you take antacids regularly, especially those containing aluminum hydroxide, magnesium hydroxide, or calcium carbonate in high doses, you're neutralizing this acid and interfering with all of these processes. In the short term, yes, you might feel relief from burning sensations, but over weeks, months, and years, you're creating serious problems. Your body responds to chronic acid suppression by trying to produce even more acid to compensate, which is why many people find they need increasing doses of antacids over time. This is called rebound hyperacidity, and it traps people in a cycle where stopping the medication causes worse symptoms than they had originally. Meanwhile, the constant pH disruption damages the delicate balance of your stomach lining. Your stomach cells are designed to function in a highly acidic environment. When you repeatedly neutralize that acid, especially after meals when your stomach is working hardest, you interfere with the normal cellular processes. Studies have shown that chronic antacid use is associated with increased risk of atrophic gastritis, where the stomach lining becomes thin and damaged, loss of parietal cells which produce stomach acid and intrinsic factor needed for B12 absorption, intestinal metaplasia, where stomach cells start to resemble intestinal cells, which is considered a precancerous change, and increased susceptibility to gastric infections, including H. pylori bacteria, which is a major risk factor for stomach ulcers and gastric cancer. Dorothy's case was a textbook example of this progression. 3 years of daily antacid use had led to significant gastric erosion and early atrophic changes. Her vitamin B12 levels were dangerously low at 180 picograms per milliliter when normal is above 200, causing fatigue, memory problems, and tingling in her extremities that she'd attributed to normal aging. Her iron levels were depleted, contributing to anemia. Her calcium absorption was impaired despite taking calcium-based antacids, putting her at risk for osteoporosis. All of this from a medication she bought over the counter and took without medical supervision, believing it was completely safe. Myth number 2, if over-the-counter antacids aren't working, you just need to take more or switch to a stronger over-the-counter option. This myth is incredibly dangerous and leads many people to escalate their antacid use rather than addressing the underlying cause of their symptoms. I see this pattern constantly in my practice. Someone starts with occasional antacid use for heartburn. When that stops working as well, they increase the frequency. When that's not enough, they switch to maximum strength formulations. When those fail, they start combining different types of antacids or adding other over-the-counter medications like H2 blockers. They never stop to question why their symptoms keep requiring more and more medication. Here's what's actually happening. If you have persistent heartburn, acid reflux, or stomach pain that requires regular medication, that's a symptom of an underlying condition that needs proper diagnosis and treatment. The most common causes include gastroesophageal reflux disease, or GERD, where the lower esophageal sphincter doesn't close properly, allowing stomach contents to flow back into the esophagus, hiatal hernia, where part of the stomach pushes up through the diaphragm, H. pylori infection, which is present in approximately 35 to 40% of Americans and can cause chronic gastritis and ulcers. Peptic ulcers, which are open sores in the stomach or duodenal lining, gastritis or inflammation of the stomach lining from various causes including stress, alcohol, NSAIDs like ibuprofen or aspirin, or autoimmune conditions, bile reflux, where bile from the small intestine flows backward into the stomach, functional dyspepsia, which is chronic indigestion without an obvious structural cause, or in rare cases, more serious conditions including gastric cancer, especially in people over age 50 with new onset symptoms. Covering up these conditions with antacids is like putting a piece of tape over your car's check engine light. The warning goes away, but the problem gets worse. In Dorothy's case, we discovered through testing that she had both H. pylori infection and a small hiatal hernia contributing to her symptoms. The antacids had been masking these underlying issues for 3 years while they progressed and caused increasing damage to her stomach lining. If she'd been properly evaluated when her symptoms first became chronic, we could have treated the H. pylori infection with antibiotics, addressed the hiatal hernia, and prevented years of unnecessary stomach damage. Instead, she'd been self-medicating with increasing doses of over-the-counter antacids, never realizing that her worsening symptoms despite more medication should have been a red flag that something else was wrong. The antacid manufacturers don't exactly discourage this pattern. Most labels say something like consult a doctor if symptoms persist for more than 2 weeks, but they're positioned right next to claims about fast relief and safe daily use. And many people either don't see that warning or ignore it because the medication is working well enough to take the edge off their symptoms. This is particularly problematic for older adults. If you're over 50 and developing new or worsening digestive symptoms, you need an endoscopy to rule out serious conditions, not a bottle of antacids from the drugstore. The American College of Gastroenterology specifically recommends that anyone over age 50 with new onset heartburn or reflux symptoms should undergo endoscopy to screen for Barrett's esophagus, a precancerous condition, and to rule out gastric cancer. Taking antacids can mask the symptoms of these serious conditions until they're much more advanced and harder to treat. Be honest in the comments. Which antacid brand have you been using and for how long? I read every single comment and I want to hear your story. Myth number 3, calcium-based antacids are actually good for you because they provide extra calcium for your bones. This myth is particularly insidious because it makes people feel virtuous about taking antacids, like they're killing 2 birds with 1 stone by treating heartburn and supporting bone health simultaneously. The marketing for calcium carbonate antacids heavily promotes this angle, with labels highlighting the calcium content and suggesting benefits for bone health. The reality is far more complex and concerning. Yes, calcium carbonate antacids contain elemental calcium, typically around 200 to 400 milligrams per tablet. However, calcium absorption requires an acidic environment in the stomach. When you take calcium carbonate as an antacid, you're simultaneously neutralizing the stomach acid needed to absorb that calcium effectively. It's a biochemical contradiction. The calcium carbonate reacts with stomach acid to form calcium chloride, which is the absorbable form. But if you're taking enough to significantly neutralize your acid, you're reducing the efficiency of this conversion. Studies have shown that calcium absorption from calcium carbonate is significantly reduced in people with low stomach acid, whether from medications, aging, or other factors. Furthermore, chronic use of calcium-based antacids can lead to several serious problems. First, there's a risk of hypercalcemia, especially in people with kidney problems or those taking high doses. Symptoms include nausea, vomiting, confusion, excessive thirst, frequent urination, and kidney stones. Second, there's milk alkali syndrome, a condition that was common decades ago when people treated ulcers by drinking large amounts of milk and taking baking soda. It fell out of favor but is making a comeback due to the popularity of calcium carbonate antacids. This syndrome involves elevated calcium levels, metabolic alkalosis where your blood becomes too alkaline, and kidney damage. Third, excessive calcium from antacids can interfere with the absorption of other essential minerals. High calcium intake can reduce iron absorption, which is already a concern with antacid use, due to the need for stomach acid to absorb iron efficiently. It can also interfere with zinc absorption and compete with magnesium. Fourth, and this is something that shocked Dorothy when I explained it, chronic antacid use can actually increase your risk of osteoporosis rather than protecting your bones. This happens through multiple mechanisms: reduced calcium absorption efficiency despite high intake, reduced absorption of vitamin D, which is needed to use calcium properly, reduced absorption of magnesium, which is critical for bone structure, and most importantly, the chronic suppression of stomach acid leads to decreased protein digestion and amino acid absorption, and your bones need protein just as much as they need calcium. Dorothy had been taking calcium carbonate antacids specifically because she thought they'd help prevent osteoporosis after menopause. Her bone density scan showed early osteopenia, the precursor to osteoporosis. When we checked her actual calcium absorption through metabolic testing, we found she was absorbing only about 40% of the calcium she was consuming, far below the normal rate of approximately 60 to 70%. She'd been taking what she thought was bone-protective calcium for 3 years, while simultaneously creating the conditions for poor calcium absorption and bone loss. The irony was devastating for her to learn. Now let me explain the real science of what's happening in your stomach when you take these medications chronically, because understanding this will help you appreciate why the solution isn't more medication, but rather addressing the root cause of your symptoms. Your stomach lining is an absolute marvel of biological engineering. It's a specialized mucous membrane that manages to survive in an environment acidic enough to dissolve metal. The cells that line your stomach, called gastric epithelial cells, produce a protective layer of mucus that's approximately 1 millimeter thick. This mucus layer contains bicarbonate ions that neutralize any acid that comes into contact with the actual cell surface. Underneath this mucus layer, the epithelial cells are tightly packed together with specialized junctions that prevent acid from seeping between cells. These cells also produce prostaglandins, hormone-like substances that stimulate mucus and bicarbonate production and increase blood flow to the stomach lining, helping it repair any minor damage quickly. This entire system is designed to maintain a delicate balance. Strong acid in the stomach cavity for digestion and pathogen killing, but a neutral pH right at the cell surface for protection. When you take antacids regularly, you disrupt this entire system. The immediate effect is neutralization of stomach acid, raising the pH temporarily from around 2 to somewhere between 4 and 7 depending on the dose and type of antacid. Your stomach responds by releasing more gastrin, a hormone that signals your parietal cells to produce more acid. This creates the rebound effect I mentioned earlier. Over time, this constant pH fluctuation and the compensatory increase in acid production puts stress on your stomach lining. The protective mucus layer can become thinner. The tight junctions between cells can become compromised. The prostaglandin production can be disrupted. This is when erosions start to form, small areas where the protective lining is damaged and the underlying tissue is exposed to acid. If this continues, you can develop gastritis, which is inflammation of the stomach lining. Chronic gastritis leads to atrophic changes where the specialized acid-producing cells die off and are replaced with intestinal-type cells, a condition called intestinal metaplasia. This is considered a precancerous change because these abnormal cells have a higher risk of developing into gastric cancer over time. The progression typically takes years to decades, which is why younger people taking antacids occasionally don't see immediate problems. But for people like Dorothy who take them daily for years, the cumulative damage becomes significant. There's also the issue of nutrient malabsorption. Vitamin B12 absorption requires multiple steps. The B12 in food is bound to proteins. Stomach acid and pepsin release the B12 from these proteins. The free B12 then binds to a protein called R protein. In the small intestine, pancreatic enzymes remove the R protein, and the B12 binds to intrinsic factor, a protein produced by the same parietal cells in your stomach that produce acid. This B12 intrinsic factor complex is then absorbed in the terminal ileum. If you chronically suppress stomach acid, you interfere with the first step of this process. Additionally, chronic antacid use can damage the parietal cells, reducing intrinsic factor production. Both effects lead to B12 deficiency, which causes anemia, nerve damage, memory problems, depression, and in severe cases, irreversible neurological damage. Iron absorption is similarly affected. Dietary iron exists primarily as ferric iron, which is not well absorbed. Stomach acid converts ferric iron to ferrous iron, which is readily absorbed in the small intestine. Without adequate stomach acid, your iron absorption drops significantly. This is particularly problematic for menstruating women and older adults who are already at higher risk for iron deficiency. The studies on long-term antacid use are sobering. Research published in major gastroenterology journals has found that people who use antacids daily for more than 1 year have significantly increased risk of vitamin B12 deficiency, with some studies showing up to 65% of long-term users being deficient. Iron deficiency anemia, particularly in postmenopausal women and older adults, increased risk of bone fractures, especially hip fractures in people over 50, higher rates of pneumonia likely due to reduced stomach acid allowing bacteria to survive and potentially be aspirated into the lungs, increased risk of Clostridium difficile infections because stomach acid normally kills these bacteria, small intestinal bacterial overgrowth or SIBO because acid normally prevents bacteria from migrating up from the colon, and some studies have even suggested increased risk of dementia with very long-term use possibly related to B12 deficiency. These aren't minor side effects. These are serious, life-altering consequences from medications people take casually every day assuming they're harmless. This is why I'm passionate about education and why I make these videos. The over-the-counter medication industry is worth billions of dollars annually in the United States alone. The marketing budgets are enormous. The shelf space in pharmacies is massive. The messaging is everywhere telling you these products are safe, effective, gentle, doctor recommended. But what they don't show you in those commercials is the endoscopy images of eroded stomach lining, the lab results showing severe B12 deficiency, the bone density scans showing osteoporosis in people who took calcium antacids thinking they were protecting their bones, the hospital admissions for severe infections that developed because stomach acid wasn't there to kill bacteria, or the cancer diagnoses that were delayed because symptoms were masked by antacids until the disease was advanced. I need you to understand the warning signs that indicate you need immediate medical evaluation, not another bottle of antacids. Seek immediate medical attention if you experience severe chest pain that radiates to your arm, jaw, or back, as this could indicate a heart attack, not reflux, difficulty swallowing solids or liquids, which could indicate esophageal stricture or tumor, vomiting blood or material that looks like coffee grounds, which indicates bleeding in your upper digestive tract, black, tarry, or bloody stools, which indicates bleeding somewhere in your digestive system, unexplained weight loss of more than 10 pounds, which is a red flag for cancer or serious digestive disease, persistent heartburn despite medication and lifestyle changes, which indicates your current treatment isn't working and the underlying cause needs investigation, chronic cough with blood or severe shortness of breath, hoarseness lasting more than 2 weeks, which could indicate chronic acid exposure damaging your vocal cords or throat, pain when swallowing accompanied by fever, which could indicate infection, or inflammation or choking episodes during sleep, which indicates severe reflux. Call 911 immediately if you have chest pain with sweating, shortness of breath, or pain radiating down your arm, as these could indicate a heart attack, not reflux. Don't assume digestive symptoms, especially if you're over 50, are benign just because an over-the-counter medication provides temporary relief. This is educational content only, not medical advice. Consult your healthcare provider before making changes to your medication regimen or if you're experiencing persistent digestive symptoms. Individual results vary, and this information is meant to complement, not replace, professional medical care. Patient details have been changed to protect privacy. The composite case examples I share are based on common patterns I see in clinical practice, but don't represent any single individual patient. If this video helped you, I need 3 things. First, smash that like button because it tells YouTube to show this to more people who are suffering. Second, share this video with anyone you know who complains about heartburn or takes antacids regularly. You could literally save them from years of damage. Third, comment below committing to one specific change you're making tonight, because accountability matters. And if you're not subscribed, what are you waiting for? Hit that button now. The pharmaceutical and over-the-counter medication industries don't want this information widely known because it affects their bottom line. But I'm a physician first, and my responsibility is to your health, not their profits. Every week I publish videos that give you the evidence-based information you need to make informed decisions about your digestive health, information that goes far beyond what you can get in a typical 15-minute doctor appointment. You deserve to understand what's really happening in your body, what the risks and benefits of different treatments actually are, and how to address root causes instead of just suppressing symptoms indefinitely. Join this community of people who are taking control of their health with knowledge instead of blindly following marketing messages. Together, we're building a movement of informed patients who partner with their doctors to make smart decisions based on science, not commercials. Your health is too important to leave to chance or to trust that over-the-counter means risk-free. Everything that goes into your body has effects, both intended and unintended, and you have the right and responsibility to understand those effects fully. Subscribe now, turn on notifications, and let's continue this journey together toward optimal digestive health based on knowledge, proper diagnosis, and addressing root causes instead of masking symptoms. Thank you so much for watching all the way to the end. It tells me you're serious about your health and willing to invest the time to truly understand what's happening in your body. That commitment to knowledge is the first step toward real, lasting improvement. I'll see you in the next video.